developing into a health center, and we've done presentations in Nepal, St. Lucia, India, but most commonly in and around Boston and southern Massachusetts. We do regular presentations at the PACE Head Start program in New Bedford and at the Boston Housing Authority.
Well, that's a good thing. Good for you. You know, that's very interesting, and this is a population that definitely needs this kind of thing. Because, are you filming? Okay.
Yes.
Because the dental health is difficult for poverty populations, which I'm sure you know about, because you have to eat, and then you have to get bus fare to and from wherever you go, work or school, and then you need school supplies, and if you get sick, you need money to pay for your illness needs, because you probably don't have health care because you can't afford the monthly fee.
Right.
So dental care is way down there on the list. So if a tooth breaks off, then you have to run around and figure out how you take care of it. So the concept of prevention is really important for this kind of population, and that's what we've been working on for 25 years, a generation and a half. So are we making inroads? Yes, I think so. It's better than it was. But there's always, you know, you always need a new toothbrush. And I know that a lot of these people can't even afford a toothbrush because it's 1,000 colones, and that's what a bag of rice costs. Or they definitely can't afford toothpaste. And so this is why, you know, this kind of thing is really important to do.
Wonderful. Could you please tell us a little more about this community in particular?
So this community was started, just keep going straight.
I just want to,
No, he's okay. Driving in the Carpio is a challenge. The community was started about 26 years ago as a result of an influx of immigrants from Nicaragua. The people came. Why did they come? Because they had been living in generational abject poverty, because they had a revolution, because they have gender issues, gender inequality issues, and interfamily violence because of poverty, again. They had a war, the revolution. They had an earthquake in 1977, and 10,000 people died in the earthquake in downtown, the capital, Managua. And so they got to a place where there was economic collapse in the country after the war. There was a hurricane also. So what do? We've got a plot of land and we have no water. We can't grow anything here. There's no economy. There's nothing to buy, nothing to sell, no raw materials available. So what do? We go to Costa Rica. A lot of people try to go to the States. The middle class and the lower middle class got to the States because they had money, but the lower class didn't, and so they just walked across the border. And they find themselves in San Jose, the capital, which is where they get dropped off, and then they go, what now? And then they discovered La Carpio. This was originally a coffee plantation. It was owned by a family called La Carpio. That's why we have the name. And the first people came and lived way in the back at the end there. And this was all paths. It was all cow paths. There was nothing here. And they built their first houses out of 4 sticks stuck in the ground with black plastic around the outside and cardboard on top. There was no electricity and there was no water. And so what they would do is walk out the road here and go out to the middle class neighborhood, which is called Pavas, which is around, like, very easy to get to. And so that's where they started. They started their work as mostly housekeepers and child care helpers, and the men did construction, guards, and gardening. And so this is how the communities began to build. As they accrued funds, they were able to put their house made out of cardboard instead of plastic, and then tin, and then cement. And so you'll see as we drive down, you'll see examples of the houses as they used to be and the houses as they are now, and then the future. The public school came here probably in 2000, and every child in the Carpio, as every child in Costa Rica, is required to and permitted free public education. But free public education requires a pair of shoes, a uniform, notebooks, and school supplies. So the people in the beginning years, when we first came here, didn't have access to that. So that was one of the things that we provided. In our beginning years also, as a foundation, we did a lot of food distribution because people weren't eating, and we had a clinic. We ran a clinic for 15 years, and the clinic saw in the beginning 40 people a day. And then we went down to 20 people a day, and then we went down to 10, and then 5, and then 20 people a week, and then we knew we'd finished our job because people were stabilizing their health and they were able to use the government healthcare system. And so those two things combined made us say, well, let's see what else we can do. So we have 3 education centers here because I believe that in the long term, well, I call it the medium term, the education of the population is very important. And in the long term, long term, the education of you who are coming here to visit is important. Because we have many volunteers, we have thousands of volunteers coming in. And if we, the people who have good services and financing, don't change our consumer habits, the system is going to continue to produce this kind of poverty. And so in the long term, we try to make it possible for people who come to help us to make like a connection with the people that live here. I call it the Walk a Mile in My Shoes program, and it's something that's, I believe, really needed, especially in the situation that we're in today with all the kind of political upheaval that we have. We need to understand that that person who's an immigrant, who's being deported, has a life, a family, a wife, kids, and they're working hard and they're trying to do better with their lives. So I think Costa Rica, and especially the Carpio, is a model for how an immigrant population could be treated and exceed their expectations, and that's what's happened here. When the people first came, it was mostly single mothers with 5, 6-year-old kids leaving behind older kids with grandma in Nicaragua. And as these children have grown, they now have children. That's how it's a generation and a half. And these, the original children got maybe to 6th grade education, but the next generation that's coming along is now going towards high school and university. And so there's between 25 and 36,000 people here. You get different estimates, but I think it's more like 25,000. These folks are going to be a voting bloc. And because the new generation that's going to be voting in the next 2 elections, because they have been raised in the Costa Rican system, the Costa Rican public school, they understand democracy, they understand how important literacy is, how important free thinking is. And so these are the people that could change the future of Costa Rica through their vote, not through their weapons as their grandfather had to do.
Okay, great.
Very good. Thank you so much.
Thank you so much.
Okay, so
Great information.
Straight.
straight.